You mentioned cold urticaria. What is cold urticaria?
Well, it's in the name. So every time a cold urticaria patient gets cold, or the skin gets cold, more precisely, there will be urticaria. It's a fascinating disease, very, very disturbing to patients, but quite impressive when you first see this, because you can put an ice cube on the skin of patients with cold urticaria and you can basically watch the wheal develop. And this happens in the skin. This can also happen in the mouth. Drinking cold beverages, for example, or eating ice cream, very disturbing. It's quite dangerous too, because some patients are allergic or sensitive to cold that is not really cold, maybe 20 degrees Celsius or 25 degrees Celsius, and swimming in a lake or ocean that is below this individual temperature threshold can cause massive degranulation of mast cells, massive whealing, and this can be deadly. So for patients with cold urticaria, it is essential to know how sensitive they are, what is the temperature that can produce the wheals, and to stay away from these temperatures, from drinking beverages that are below these temperatures and from swimming in water that is below those temperatures.
How can you exclude that the patient isn't allergic to water?
Yes, there is such a thing as water allergy. Well, we call it aquagenic urticaria, another very rare form of urticaria where any type of water, or some waters only, salt water or non-salty water, even tears can produce the wheals, independent of the temperature. Warm water will do this, cold water will do this. So in order to distinguish between water and cold, we expose patients to cold without water. We put an ice cube in a plastic bag so that there is no water. We use TempTest as a machine that works without water. And if patients react to these temperatures, then they have cold urticaria. And if they don't, but they are sure that cold water does it, well, we will expose them to water, put water on their skin with a wet cloth, and leave this on there for a couple of minutes to see, does this result in the induction of urticaria. You see, it's pretty much the same in all the chronic inducible urticaria. Something from the outside makes it come, so we want to reproduce that and tell patients, is it relevant? Is it useful to avoid this trigger? And well, how strong does the trigger need to be to cause the symptoms so that we can optimize treatment?
You mentioned aquagenic urticaria. I heard a lot about aquagenic urticaria. Be honest, how many patients with urticaria have you seen in your life, and how many patients had aquagenic urticaria?
Well, the reason why you hear about aquagenic urticaria is because this is horrible. As you can imagine, someone who cannot take a shower, who cannot wash themselves without breaking out in hives, is immensely impaired. So this is a story that you will hear about. It's rare. We know 10, 15 patients with aquagenic urticaria, and we are a big center for patients with urticaria. So there are not many patients, but the patients who are affected suffer tremendously and really need help to live normal lives.